HIV infection and AIDS. HIV means human immunodeficiency virus. This is a virus which causes ultimately the very dangerous and fatal disease called as AIDS in the last stages of the infection. This virus is single-stranded RNA retrovirus, and it is transmitted through contaminated sex function. If one of the sex partner is HIV positive, it may transmit this virus to the healthy sex partner. This virus, after entering through the abrasions in the penis or the mucosa of the vagina, passes into the bloodstream where it attacks the defense system of the body, that is immune system, especially the T cell CD4 cells. It penetrates into the T cells where it undergo changes from RNA to DNA. That is why it is called as retrovirus. It is basically a RNA single stranded, but it is converted within the cell of the T cell into the double stranded DNA and enter the DNA nucleus of the T cell, where it commands for the manufacturing of the protein which is essential for the replication of the HIV. Due to this process of replication, production, billions of the viruses are produced, and by the death of at the cost of the T cells. The T cells, they are dying one, and there is overproduction of the HIV. So this HIV in the bloodstream passes to the various organs and produces various symptomatology or the symptoms in the human body. So basically it damages the immune system of the human body. Due to there is immune system is weakened and the person cannot face the various infections, especially the infection of the bacteria, parasites and other viruses. Due to weakness in the defense system, because immune system which is consist of CD4, T cell, B cell, lymphocytes, monocyte, gametocytes, all the group of the WBC. So these immune system is damaged, defense line is weakened, so the body cannot face the various infections or the pathogen entering in the body and produces the various other diseases. As the immune system and the defense system of the body is weakened, other various diseases which are called as opportunistic diseases like TB, toxoplasmosis, then there is cervical carcinoma, sarcoma. These are the other diseases, they may come into the action and further damage or the harm the patient due to the secondary or the opportunistic diseases. Carcinoma, sarcoma, tuberculosis, these are all the opportunistic diseases which come into action when the immune system or the defense system is weakened due to the HIV infection. Mode of transmission is mainly through the sex functions by the unprotected sex. If the partners do not use the condoms, vaginal or the male condoms, then there are more chances for the virus to enter into the bloodstream and infect the healthy partners. Moreover, use of the contaminated syringes, especially the drug addicts, they use these syringes with mutual sharing of the syringes for drug addiction and transmission, for IV infections of the various addicts, drugs, and the blood transfusion. So, before blood transfusion, I mean the test for the virus is compulsory. Blood screening for the virus is compulsory one. Contaminated blood without test or screening test, that might infect the person who is going to get blood transfusion. So, contaminated sex, unscreened blood transfusion, and the sharing of the contaminated syringes. These are the mode of transmission for this dangerous and fatal virus. Another mode of transmission is vertical transmission. That is, if the mother, pregnant or a pregnant female, is HIV positive, then the baby will suffer from the mother during the process of pregnancy, during process of delivery, and even after delivery. The secretions of the vaginal may infect the neonates. So this process of contamination or the transmission from pregnant mother which is HIV positive to the neonates is called as vertical transmission. So these are the various methods of transmission which are the etiological factor for transmission of the virus from the contaminated infected person to the healthy ones. So this virus is basically an attacking virus to the immune cells. So the vitality is suffering from the attack of these billions of the viruses one. So ultimately, after, if early diagnosis and the early treatment is not adopted, then the final stage, which may be after 10 to 12 years, then the final stage due to this infection of HIV is called as AIDS. AIDS is acquired immunodeficiency syndrome. So this disease is it is a syndrome, it is not a disease, because there are group of symptoms which are present in this pathology. So it is called as syndrome because the various organs, they are damaged and suffering due to the infection of this HIV virus. So when AIDS is prevailing, that is the final stage has entered, then it is very difficult to survive for the patient. So the preventive measures and the early diagnosis, early treatment by the antiretroviral therapy or the drugs cannot destroy or eliminate and make the patient HIV negative, but the index or the, you can say, the count of the virus is lowered. Due to lowering of the count of this virus, the patient cannot transmit this virus to the healthy ones. So these drugs, they prevent and give health to the CD4 and T cells, and they prevent the progression of the disease.